Let's discuss today electrocardiogram. People call it ECG. What is ECG? Your doctor may suggest you get an electrocardiogram, also called an EKG or ECG, to check for signs of heart disease. It's a test that records the electrical activity of your ticker through small electrode patches that are technician attached to the skin of your chest, arms and legs. ECG are quick, safe and painless process. With this test, your doctor will be able to identify your heart rhythm, see if you have poor blood flow to your heart muscles, diagnose a heart attack, check on things that are abnormal such as thickened heart muscle, detect if there are significant electrolyte abnormalities such as high potassium or high or low calcium. Let's discuss how an ECG is carried out. There are several different ways an ECG can be carried out. Generally, the test involves attaching a number of small sticky sensors called electrodes to your arms, legs and chest. These are connected by wires to an ECG recording machine. And actually you don't need to do anything special to prepare for this test. You can eat and drink as normal beforehand. Before the electrodes are attached, you will usually need to remove your upper clothing and your chest may need to be shaved or cleaned. Once the electrodes are in place, you may be offered a hospital gown to cover yourself. The test itself usually only lasts a few minutes and you should be able to go home soon afterwards or return to the ward if you are already staying in hospital. How should I prepare for this test? Something you can do to get yourself ready before this test: avoid oily or greasy skin creams and lotions the day of the test because they can keep the electrodes from making contact with your skin. Avoid full length hosiery because electrodes need to be placed directly on your legs. Wear a shirt that you can remove easily to place the leads on your chest. These are some information, but it depends on the situation, but depends on whether you are a male, female or a child. Why ECG test is done? An electrocardiogram is a painless process and non-invasive way to help diagnose many common heart problems. A healthcare provider might use an electrocardiogram to determine or detect irregular heart rhythms, if blocked or narrow arteries in the heart which are causing chest pain or heart attack, whether you have had a previous heart attack, and how well certain heart disease treatments such as a pacemaker are working. You may need an ECG if you have any of the following signs and symptoms: chest pain, dizziness, lightheadedness or confusion, heart palpitation, rapid pulse, shortness of breath, weakness, fatigue, or a decline in ability to exercise. So these are the symptoms. If you are feeling, if you are realizing, and if you are seeing your symptoms in yourself, then you need to consult about your doctor about your health problem. Getting result and understand the ECG result mean. Let's go. An ECG recording machine will usually show your heart rhythms and electrical activity as a graph displayed electronically or printed on paper. For an ambulatory ECG, the ECG machine will store the information about your heart electronically, which can be accessed by a doctor when the test is complete. You may not be able to get the result of your ECG immediately. The recordings may need to be looked at by a specialist doctor to see if there are a sign of possible problems or not. Other tests may also be needed before it's possible to tell you that whether there is a problem in you or not. You may need to visit the doctor, clinic nearby your clinic or nearby your doctor a few days later to discuss your result with your doctor or technician and who know very well about the result mean of ECG. Thank you very much for watching the video.